Do a keto diet and diabetes make a perfect match? Some experts and diabetics think so. When you follow a keto diet, your body converts fat, rather than sugar, into energy, which may improve blood sugar levels while also reducing the need for insulin. In many ways, a ketogenic diet seems like it's made for people trying to avoid or manage diabetes because it takes away two of the most concerning aspects of most diets: sugars and carbohydrates. While following this new way of eating, diabetics have seen drastic reductions or even elimination of their medications. More on those studies to come. And don't worry, this diet doesn't make you feel deprived. If anything, it has a reputation for making people feel very satisfied and energetic once they reach a state of ketosis. Let's take a look at whether or not the keto diet may be a healthy choice for you and your diabetes management. Keto diet and diabetes for people with pre-diabetes, type 2 diabetes and type 1 diabetes. Minimizing sugar as well as carbohydrate intake is typically recommended to maintain healthy blood sugar levels. The ketogenic diet is a very low-carb diet that changes the body's fuel source from burning glucose or sugar to burning dietary fat instead. Making this major switch in dietary habits promotes a state of ketosis, which means your body is now a fat burner rather than a sugar burner. Research as well as first-hand accounts show that this ketogenic way of eating may help some diabetics to decrease and better control their blood glucose levels. Ketogenic diet for pre-diabetes. Obesity is one of the principal risk factors for diabetes, and following a ketogenic diet has been shown to help with weight loss. According to a scientific article published in 2014, a period of low-carbohydrate ketogenic diet may help to control hunger and may improve fat oxidative metabolism and therefore reduce body weight. Many pre-diabetics struggle with being overweight, so a keto diet can help promote weight loss, which can help to decrease the chances of developing full-blown diabetes. In addition, as the Harvard School of Public Health points out, carbohydrate metabolism plays a huge role in the development of type 2 diabetes, which occurs when the body can't make enough insulin or can't properly use the insulin it makes. When a food containing carbohydrates is eaten, the digestive system has to process these carbs and turns them into sugar, which then goes into the bloodstream. The ketogenic diet majorly minimizes carbohydrate intake, so pre-diabetics, as well as type 1 and type 2 diabetics, aren't challenging their bodies with carbohydrate breakdown that can raise blood sugar levels and create problematic insulin demands for the body. Keto diet and type 2 diabetes. Is a keto diet good for type 2 diabetes? The keto diet can be very helpful for type 2 diabetes since the body is now using fat rather than carbohydrates as its main source of fuel. This way of eating decreases the body's demand for insulin and helps to keep blood glucose levels at a low yet healthy level. If you're a type 2 diabetic who takes insulin, then you may likely need less insulin as a result of following the ketogenic diet. A keto diet and diabetes study published in 2012 in the journal Nutrition compares low-carbohydrate ketogenic diet (LCKD) with a low-calorie diet (LCD) in improving glycemia, the presence of glucose or sugar in the blood. Overall, the study finds a low-carb keto diet to be more beneficial than a low-calorie diet for obese type 2 diabetics. The study concludes, the ketogenic diet appears to improve glycemic control. Therefore, diabetic patients on a ketogenic diet should be under strict medical supervision because the LCKD can significantly lower blood glucose levels. Previous research has also shown that for patients